Good morning, ladies and gentlemen. How are y'all doing? Dr. Coop MD here once again with a little heart disease related tip. That, before we get started, back in the background there, way back in that looking out the window, is downtown Kansas City, Missouri, where we will be celebrating another Chiefs Super Bowl championship on Sunday. If you had any doubt about it, I'm just going ahead and tell you right now what's going to happen. But anyway, another DM a few days ago, which I really like. It makes me think. It makes me start doing a little bit of refresh, if you will, on my information. And always trying to give you something you can use, okay? Not all this fluff and statistics and all that other crap. It is what it is, because at the end of the day, we can't slice and dice you up into all these little pieces. Okay, so here we go. So today's question was heart disease and the menopause. And this is specifically, obviously, for women. Women develop cardiovascular disease in general a little bit later in life than men. And the thinking, since I've been in medicine for 30 years, has been that there's somewhat of a protective effect of estrogen during the woman's reproductive years, which makes sense because we know some of the hormonal effects on the vascular system in general. So that's kind of one of the big sort of general caveats when it comes to heart disease and the effect of menopause on heart disease. So when that estrogen falls off during the menopause, there are a lot of other things that sort of kick in. We know that cholesterol levels, for example, are higher. We know that women are more likely to gain weight and become obese or overweight after the menopause. And so along with that comes all of the other issues related to the development of other risk factors. Obesity, which leads to hypertension, hypercholesterolemia, type 2 diabetes mellitus potentially. And so in addition to losing the protective effect directly on the vascular system, you now are susceptible to development of some of the risk factors that can lead to the development of cardiovascular disease. I personally think, as a man, and certainly here in the last couple of years, when I've got this now interest in treating people with obesity, that this hormonal change that women go through during the menopause is probably one of the underdiagnosed and undertreated issues of our time. And so I think probably the message here is that there's probably not a very specific thing, but a multifactorial set of variables related to the menopause that lead to women having that onset, if you will, or that equalization of cardiovascular risk with men. Okay, so menopause has a significant effect on your development of risk factors for cardiovascular disease, but here's something you really got to think about, and that is the outcomes related to treatment, related to the impact of cardiovascular disease. In other words, heart attack, heart failure, and some of the other things. Women die at a much higher rate than men. Even, what I do, my bread and butter, which is bypass surgery. For decades now, women have had poorer outcomes after open heart surgery than men. And then if you start thinking about it in terms of minority women, you can basically exponentially increase those poor outcomes, okay? Now, the outcomes overall are very, very good. They've got much better in the 3 decades that I've been in medicine, okay? But when you compare to men, they're worse, okay? So I think it's very, very important for you, for the person who asked me this question, is really, really have a real heart-to-heart discussion, no pun intended, but intended, with your primary care provider. If they're not addressing these hormonal issues with you, then it may be time to think about getting another provider. I just have to say that, and I'm not afraid to say it. Doctors have got to stop this, skimming over the top. Oh, your cholesterol is, oh, it's okay, and this. But there's so much more to dissect on an individual basis for every one of us that requires a lot more time. Unfortunately, for a lot of practitioners, don't have that time. But you really got to be your own advocate, okay, and begin to understand these things and have those conversations with your doctor. So bottom line, yes, women experience heart disease issues at a little later point in time relative to men, okay, because of the protective effect of estrogen, okay, which is the kind of prevailing kind of thought, okay. There are, number two point, there's a number of factors that go into the perimenopausal transition for women that need to be considered, okay. Number three, what it really boils down to at the end of the day, in addition to getting those hormone issues dealt with, is understanding all those other risk factors that can develop as you get older, okay? Those related to the hormonal changes, as well as some of those that are related to aging in general, okay? So understanding your risk factors, very, very important, okay? Talking to your doctor and doing all you can to figure out how to best modify, treat those hormonal imbalances that may be very specific to you. Now, I have to mention, and to be responsible in this conversation, there's always the question because, well, can I just take more estrogen? Well, there's the other big issue here for women, which is the estrogen effect on potentially development of breast cancer. And so you got to have that conversation and sort of think about how it all balances out with you over time. So very important discussion, very important question to ask your doctor, okay? There's no panacea answer for that except to say this, is that yes, menopause does have an effect on your risk for development of cardiovascular disease and some of the things that can lead to cardiovascular disease, all right? And then finally, remember this. I'm not a fearmonger, but remember that the outcomes related to not just pills even, but direct interventional type treatments for cardiovascular disease can be worse in women, okay? So think about those things when you have these discussions with your doctors. So you put me on point, now I'm putting you on point and putting your doctor on point to go have this conversation about where you stand. And there's so much out there now. I'm gonna have to, we're getting a little long on this video, but there's so much now with genetic testing and now this whole new thing with gene splicing and taking a deeper dive on some of the very micro hormonal processes, inflammatory processes in our bodies. There's so much more now that we're able to understand about our own individual biology. So important to ask those questions. Don't stop till you get the answers that are right for you. Ladies and gentlemen, this is Dr. Coop, MD, once again coming at you with another little heart disease or heart month nugget. I love you, and ain't a damn thing you can do about it. Have a fantastic day. Have a fantastic weekend, and go Chiefs.